Good afternoon. I want to share with you a story like always. Imagine you've worked hard your entire life. You built homes, you worked in a shipyard, you served in the Navy, you did uh, brake repairs and installed insulations, and then you retired thinking your hardest days were behind you. And then 20 years later, your doctor tells you you have mesothelioma. First, you have a hard time capturing that name, and then eventually you say mesothelioma. And your first question is, how the heck can cancer appear after so many years? I like to answer that question, and hopefully, this can help you because it's a personal question about a friend of mine named John, or at least for this video, I'm going to call him John. Dr. Alex Ehsan, I'm a medical oncologist. I'm also a hematologist and I treat a lot of patients with different types of diseases. John is interesting. I want you to meet him. He's 72 years old. He spent most of his life working as an electrician. He loved his work, never smoked, remained active. He was one of those guys that could go up those wooden poles with no fear. He enjoyed his retirement with his wife, and one day he started feeling short of breath. And what he had told Mary, his wife, was that, I'm getting older. And then she said, walking up one flight of stairs and becoming short of breath is not like you. Eventually, he went and saw his primary care doctor, who did a chest x ray, and it showed fluid around his lung. And what we do as doctors usually is we get rid of this fluid, which is called thoracentesis. Unfortunately, it kept building back up. A CT scan led to a biopsy. Then he met a pulmonary doctor who specializes in mesothelioma of the lung, which is called pleural mesothelioma, and he was diagnosed with it. And he kept on telling me, Dr. Ehsan, I never smoked, and why am I getting lung cancer? Mesothelioma is a rare cancer that develops from the mesothelium. This happens to be the thin lining surrounding the lungs. The same thing happens in the abdomen, so you can have mesothelioma of the lung or mesothelioma of the abdomen. It could also happen around your heart. The less common place is the testicles, and 80% of the patients typically have mesothelioma in the lungs or the lining of the lungs called the pleura. Uh, and really, this has to do with a nasty fiber called asbestos fiber that are inhaled and they end up getting trapped inside the lining of the lungs or the testes or any place that they end up being in. And they kind of remain there dormant for decades, and the body cannot get rid of them. So over time, inflammation develops, DNA damage accumulates, and eventually it turns into a cancer. What makes mesothelioma unique is that it's got an extremely long latency period. Symptoms can appear 20 years after you were exposed. Many patients have already retired from the hard work they were doing. Shipyards, construction, mining, manufacturing, power plants, insulation work, brake repair, military service, and combination of some of these all together. Typically, the patients show up with cough, fatigue, shortness of breath, like any lung cancer, I've had patients with chest pain, and a common denominator quite often is the fluid that builds up around the lungs called the pleural effusion. And it's not rocket science to make the diagnosis. We normally do a PET CT scan, sometimes an MRI. We drain the fluid, and sometimes we require a biopsy to be certain that we are doing what's called immunohistochemical stain, or IHC, to make sure that we are dealing with a mesothelioma of the lung versus mesothelioma of the other sites, or even metastatic lung cancer. The treatment really depends on the type of mesothelioma, and in selected patients, we do surgery, but almost everybody I've treated in the past 25 years ends up getting some form of surgery, chemotherapy, radiation therapy, and to be very blunt, all three. One of the biggest breakthroughs in the recent years has been immune therapy, and the combination of two of them, one is called Opdivo, the other one is called Yervoy, has definitely kept a lot of my patients alive with what is considered unresectable pleural mesothelioma. However, chemotherapy or poison therapy with carboplatin and Alimta and even Avastin is important, because sometimes people cannot handle immune therapy because of autoimmune disease like rheumatoid arthritis, and we have to go back to carbo, Alimta, and Avastin. Uh, Patients are definitely living longer, feeling better, and the fact that we are able to give them treatments that they can handle are really promising. If you've been exposed to asbestos, don't panic. Most exposed individuals never develop mesothelioma, but if you experience persistent shortness of breath or recurrent fluid building up around your lungs, please go see a doctor. Make sure they're aware of our talk and our little gathering about mesothelioma. If you're my patient, and I have a few with mesothelioma, I look forward to seeing you soon with a normal PET scan. And if you're not, I look forward to never meeting you, mainly because I don't want you to have cancer. I wish you the best of luck, and I'm going to try to type this up as best as I can, and hopefully this will be useful to you.